All right, every parent knows that colds and coughs are common with children, but when those symptoms just won't go away, the illness could develop into pneumonia and, of course, require medical care. 6 News anchor Lori Tucker joins us now here in the studio with much more. Lori?
Well, Kristen, pneumonia is a lung infection which can be caused by a virus or bacteria, and it often starts with an upper respiratory tract infection. Well, joining us now to talk more about that and help you parents at home is Dr. Katie Stordahl, ER physician at Children's Hospital. Always good to see you.
Thank you.
Let's begin by talking about the signs and symptoms we need to look for.
It actually depends on the type of pneumonia. Walking pneumonia can cause a sore throat, headache, hives, wheezing. People may feel tired, but they usually don't have as bad of a cough and they may not have a high fever. With a bacterial pneumonia, kids usually get sick pretty quickly with high fevers. They may grunt or work hard to breathe or breathe really fast. With a virus, it may just seem like a lingering cough that won't go away for 2 or 3 weeks. So it really depends on the type of pneumonia that your child has.
I didn't realize hives were part of the equation with walking pneumonia, and that can be really serious too, yes?
Well, it can be if hives are associated with an allergy. If they're associated with the actual walking pneumonia bacteria, they're usually fine.
You're okay. All right, good to know, because a lot of parents have asked me about that. How serious is walking pneumonia? Now, another thing people want to know, is pneumonia contagious?
It is, especially depending on what type it is. Again, and the things that you want to look for with contagiousness are coughing on other people, using the same tissues, eating utensils, sleeping in the same bed, using the same cups. Those are the kind of things that are going to spread it, the common sense type of things. Once someone has been on an appropriate antibiotic for at least 36 to 48 hours for their type of pneumonia, they're usually no longer contagious and those kids are ready to go back to school.
All right, and speaking of that, you know, what are some complications if you just let it go? You don't realize what you're dealing with. It could get pretty serious.
Yes, and you're right that it usually starts out as a cold, and what happens is that the cold virus damages all of the little hairs that line your breathing tracts that prevent bacteria from getting in. Once those bacteria get in and you have the more severe symptoms and usually the fever, starting with the typical bacterial pneumonia, you have to worry about, is your child getting enough oxygen? That's something that we would always check in the ER at the doctor's office. Are they eating and drinking okay? Kids often, especially babies, will get dehydrated with pneumonia. And are they working so hard or breathing so fast that they really can't keep hydrated at home? So those are the 3 things that we mainly look for in the ER to determine if a baby or an older child needs to be admitted for IV antibiotics.
Okay, so those 3 things obviously we need to monitor at home, and that's when we go to see you at the ER.
Absolutely. If a child is grunting, if a baby is bobbing their head like this, where they're not holding it up, if they're pulling muscles on their neck or their chest, or they ever look blue, that means you either need to call 911 or come to the ER right away.
All right, always good advice. Thank you so much, Dr. Stordahl. We'll see you again next time. And if you have a question about your child's health, just send me an email at ltucker@wate.com. We'd love to hear from you, and be sure to tune in every Thursday here on 6 News at 5:30 to see if we use your question on the air.